You're watching The Road Back 85 on YouTube. This episode is about PPIs, proton pump inhibitors, when they are a miracle and when they become a murderous weapon. PPIs are a miracle when you need them for gastritis or duodenitis, which are mucosal damage lining to the cell wall, the exterior cell wall of your stomach. And in other parts of the digestive tract, they are called different things, like the duodenum, which is the first part of the small intestine, which is several feet long. The first part of the small intestine is called the duodenum. It's where most of the absorption is taking place. And when you have anything wrong with the duodenum, not only does your absorption start to decline, which is malabsorption of vitamins and minerals, but also you also can get the stomach pain and the nausea and the vomiting, along with gastritis, which is mucosal damage to the lining some places in your stomach. You could just have it at the bottom of your stomach, because that's usually where it starts. It's having problems processing going into from the pyloric valve into the duodenum. But essentially, my point is, people can get gastritis from being on proton pump inhibitors. They can also have gallbladder failure because it slows down the motility of your digestive system. It stops all proton pumps or the pancreatial cells of the lining of your stomach from producing HCl, or hydrochloric acid. And essentially, the pancreas is the one vital organ, like the liver, that is in this digestive process, that basically the pancreas tells the stomach, don't make any more hydrochloric acid. Therefore, you can get pancreatitis, not just from gallbladder failure and a bile stone blockage, but you can get it to begin with because it's signaling the stomach. So it's the pancreas is attacked first, simultaneously telling the stomach produce no more acid, and over just a few weeks of taking 40 or 80 milligrams of a PPI like Nexium or Protonix or Prilosec, even though it's a PPI, it's over the counter, it's a little less effective, and it typically does not do the job well because it's a lesser strength, even though they claim that it's a PPI. I don't believe that, because it does not give you the relief that a proton pump inhibitor does when you actually have gastritis. And when these things happen, it's a vicious cycle. Proton pump inhibitors cause mucosal damage themselves. They cause the problem that they are intended to heal. They can be a miracle if you need them for mucosal damage, whether it be because of an infection causing mucosal damage, or whether it's because a drug caused mucosal damage, kind of like the dopamine reuptake inhibitor drugs like Wellbutrin, like I talked about in the first episode. Essentially, when people get caught in this nightmare, they believe that proton pump inhibitors are miracles, and they are when you need them, and they can heal gastritis in 2 weeks. However, when you get suckered into believing from a GI doctor, a gastroenterologist, or a regular internist, or even an ear, nose, and throat, an ENT doctor, some of them tell you, oh no, it's no big deal, you can take a proton pump inhibitor for your hoarseness. I'm hoarse right now because of the 3-year nightmare that I've been going through because of losing 3 organs and having severe damage to my GI tract, the mucosal damage, for many months, and no one wanted to do any specific testing or take a look down there, which they should have, and many other misdiagnoses and medications that were never needed, and they caused more harm to me. If you don't think that a PPI can cause damage, all you need to do is look on the internet. There are people screaming about them all over the place. And I will tell you, they are a vicious cycle drug. If you were to take a PPI or an over-the-counter drug every day, you would start to have severe stomach pains, rancid back pains, your body feeling weak, your stool patterns would change. In that process, you probably will lose your gallbladder, probably get pancreatitis, which goes away when the gallbladder is removed. But when the gallbladder is removed and you're still taking the drug, it's causing more and more damage. It's a vicious cyclic drug. It can cause damage, it can heal damage. Then it can cause more damage when it's healing the other damage. And this is a proven fact because there are many people that it's happened to, and I don't know why it's even a question, because doctors are essentially covering themselves. But the way I see it is, if you're going to be a doctor, you're there to help people, not harm them, and you're going to do the right thing. You're going to have people having issues throughout their entire lives, not because of drugs, but because of stress and fundamental things that create disease in the body. And these things will happen naturally because of things. But if you're going to actually give someone drugs that cause problems, and you should know better because you went to medical school, or unless you just went there and passed the tests and have no common sense, or unless there's a PPI 101 class that basically says create patients, kill their digestive systems, then, well, you know what I'm saying, especially if you've gone through the PPI nightmare. And there are many studies online, and the one study that does cite this very thing is one done in North Carolina at Chapel Hill several years ago. Essentially, healthy people took H2 blockers, which are like Zagrid and the other omeprazole and all these other things over the counter. They're H2 acid blockers, which are done a different way, and they don't eliminate all the acid like a powerful proton pump inhibitor. And in just a few days, people were getting tiny gallstones from those. So therefore, what do you think 40 or 80 milligrams of Protonix or Nexium will do to someone in 1 week? If they had a clean endoscopy, nothing wrong with them, biopsy's negative, you're going to have a massive gallbladder attack, a massive stone form in 5 to 7 days. This concludes the second episode of The Road Back 85 on YouTube. I hope you were able to obtain some information from this.